Now, with Tanya Francisco and Amy Rutledge, this is Daytime Chicago.
Patients who once had to drive or fly for hip and knee replacement consultations can now get the help they need in the comfort of their own home.
Hip and knee replacement surgeon Dr. Richard Berger joins us now to share about his new telehealth program along with his patient Wes Blume. Thank you both for coming in. And Wesley, you took advantage of this telehealth program because you lived in downstate.
Correct.
Okay, so it was very good for you to be able to avoid having to drive up to Chicago and to get the treatment, to get the consultations. The treatment,
Right.
obviously, you had to do in person. Tell us a little bit about your backstory. You're a grain farmer from downstate.
Grain farmer from downstate, and
Your pain
was pretty bad, but then sometimes it would let up a little bit, and then it got to the point where there was no more letting up, and the procrastination had to end.
Okay.
So, Dr. Berger, how does this work? I assume that as a patient, he got to a point where he already knew he needed surgery, and then he comes to you and you do consults via the telehealth. Is that correct?
Right. We developed the BEST experience, which stands for Berger Elective Surgical and Telemedicine, where we marry together surgery and the modern telemedicine. It's kind of like the Jetsons, where the doctor pops up on the screen. So it really works nicely in that patients who think they need surgery or just want a consultation, they can come see me in person for sure, but patients from a little far away or very far away prefer to do it on the computer. So we talk to them, we see them, we figure out if they need surgery, we even schedule surgery on the computer with them. They come up and they have the surgery, then they go back home, live their life, and they follow up with us on the computer. And we do whatever they want. If they want to do more computer stuff or more in-person stuff, whatever they want, we want to make it easy for them to get their life back by having a joint replacement.
And I imagine that also takes away a lot of the procrastination that you see with a lot of people who are hesitant to have this surgery.
So many people are hesitant. They're afraid. They're afraid of pain. This is almost painless. They're afraid of being off for work for a long time. You can get back to work in a few days or a week. So it makes it easier, and there's now no reason to procrastinate. Take your life back.
Because you do orthoscopic surgery, correct? Like you said, it's minimally invasive.
I do minimally invasive joint replacement, so we take out the old joint, we put in the new joint, but we do it through a small little incision without cutting the muscles, ligaments, and tendons. Most of our patients go home the day of surgery. Most of our patients are back to their desk job in a week, driving in a week. It's very, very quick.
Okay, and how was your life change, Wesley?
Just drastic.
Left you speechless.
Literally, it was a night and day experience for me.
We were talking a little bit before the show. You told me you checked into the hotel, and then you went in to have your surgery, and you're coming back here. This is you walking here. This is how much pain you were in, and you come back out, and you're back at the hotel the same day, in a matter of hours.
Right.
How was your life? Look at this. This is you after. Look at you walking with such ease. That's 3.5 weeks.
That is unbelievable.
How did your life change?
I was just able to do everything that I was able to do before and get more or less pain-free. I was just got my life back.
Okay, so because it was at a point you were
stairs.
starting to have to hand off a lot of your duties to your son because you weren't able to do them. You were in so much pain.
Right.
And then you had the surgery, lickety-split, right back?
Past fall was just back to the way it used to be.
That is amazing. And you've had a handful of clients that people might have heard of before, so this is not the first surgery you've done.
So I'm very fortunate to treat a lot of famous people from all over the country, in fact, all over the world. But it's wonderful to treat people who just want to get back to grain farming, get back to taking care of their grandchildren or taking a walk around the block with their dog. My best stories are patients who are teachers who get back to teaching kids, who are ready to retire because they couldn't get up the stairs in the public school and now are skipping up the stairs. It's just remarkable how much this arthritis takes away your life, and this gives it back to them. And now we made it easy. We made it easy with minimally invasive surgery, which doesn't hurt and recovers so quickly. Patients can get back to their hotel a couple hours later and back to work right away.
They're up and walking. You use your engineering background, if I'm understanding correctly. Had an engineering
I've got a
background.
degree in mechanical engineering from MIT, invented all these tools and new procedures so that we don't cut the muscles, ligaments, and tendons. That just allows the surgery to be easier and recover so much faster with less pain.
And you're up and walking the same day of the surgery.
You're actually home the same day of surgery.
crazy.
You
Yeah.
walk home the same day, not in a wheelchair.
Exactly.
But you walk home. We give patients a cane, and some use it, some don't. But most patients are up and walking within a couple hours, back home in a couple hours.
That is unbelievable.
Amazing.
Fantastic.
We do this a lot at Rush Hospital. We call it Rush Hospital because the patients rush out of the hospital.
Dr.
love
Berger.
that.
I love a doctor with a sense of humor.
both
Thank you
for
so
being
much.
here.
I
It's
appreciate
wonderful.
that. And congratulations, Wesley.
Yeah, that's
very
great.
much.
Good for you.
If you'd like to book your appointment with Dr. Richard Berger, call the number right there on the screen or go to outpatienthipandknee.com.